All right, guys, we are back with another podcast episode. Today, super excited to be joined by Navin Nagiah, co-founder and CEO at Daffodil Health. Navin, I know some of the investors that, backed your Series A, Flare Capital, so that's super exciting. We're going to get into, the Daffodil model, your background, and everything in between. But first off, how are you doing today?
I'm doing great. Thank you for having me on this podcast. I'm looking forward to this. I think things like this, I hope to contribute, but at the same time, I also hope to learn. So looking forward to it.
Of course. Yeah. Likewise. And so if anybody who's listening has any thoughts as well, feel free to, shoot me a note. My line is always open and Navin's is as well. And so Navin, would love to maybe just dive in head first. Would love to hear more about your journey, how you got into healthcare, background, and kind of, the state of things today. We can kind of go from there if that works for you.
That works great. So I would say the way I look at myself, I would say I'm an engineer by education and a business builder by profession. The first chapter of my career was mostly in high tech. After graduating with a master's in electrical engineering from Kansas State, I joined a startup in Pittsburgh as one of the first 10 employees, number 7 and number 8, out of an apartment in Pittsburgh. This was in the mid 90s. The internet was very new. The web was very new at the time. And we were building a web-based financial information service. So that was the venture where I understood that it is possible to start with an idea, build a product, build a company, add value, and do something impactful, right? That was the first experience. It was a fantastic experience. I was on an accelerated learning curve. The company grew to a local presence in over 25 countries. I ended up setting up operations in China, India, Southeast Asia. And we eventually ended up selling the business to a financial institution in London. So it was a fantastic experience overall. Now, after that, as it happens often, you think that you've figured out how to build a business. So I took the money I made in that and put all of it, along with a co-founder, into the next venture I did, which was automating procurement. Without getting into a lot of the details, because I don't want to make this whole podcast about my background, but this was a character building experience. I learned a lot of humility here. I learned what I did not know. So after 3 years of building it, we ended up doing an asset sale of the business, but I did lose my shirt on the deal. I still remember Menlo Ventures offered us a Series A term sheet, and we said no because we wanted to build a business with our own money to get it to a pre-money valuation of 100 million before letting anybody in. So I learned a lot about getting people involved, building as a team, and some humility, some character building in that process. So that was the second venture. After that, I did two more. I was hired as a CEO for an open source consulting business, Signex. And then I got involved in an open source project called .NET Nuke, and I teamed up with the founders of the project to commercialize that, ran that business for 9 years before selling to a private equity firm. So that was the first chapter in high tech. Somewhere in the middle of that, it's very specifically when I was doing DNN in that 9-year journey, I remember a period of time when I was under a lot of duress. We had done venture financing, of course. We also did some debt financing with a couple of rounds of layoffs. We were pivoting the business. So in the middle of that, I remember having lunch with a friend in San Mateo and saying, this is so hard. The next one I do, I want it to be something that matters, something that makes a difference, something that has impact. So after this first chapter, I went to McKinsey, and then I went to Multiplan. I ran product at Multiplan, now called Claritev. And when I saw the problem in healthcare, when I saw how vast the industry is, but also the complexity and the challenges it has, I felt that this was a good one I could sink my teeth into. This was more cost driven, building a business that could reduce healthcare admin waste, that could make things better. So I decided to pursue this. So that was essentially the genesis of Daffodil.
Okay, yeah. And would love to just double click real quick, just because it's interesting. I heard some introspection from you around, humility and people building and those sorts of things. And so as you moved into other parts of your career and in building Daffodil, how are you kind of, starting with that framing versus what you had before? How do you kind of make the best of both worlds, if that makes sense?
Yeah, that's a great question. I think a few different things, right? When you go through an experience like that and you become a little bit older and hopefully a bit more wiser and mature, I think you learn that, it takes a village to build a business, or it takes a large group of people. It takes people with different competencies. It takes people with different perspectives, with different skill sets. And my goal as an entrepreneur business builder is to make sure that all these diverse perspectives, different skill sets come together to create music, right? To create an effective organization, to create a product that makes a difference, that to create a business that moves the needle for the industry and for society in a positive way. So that's how my perception of my role has changed. It is more helping play the music by putting the right ingredients together, creating an environment where exceptional people can do exceptional work. So I think that's been the main shift. The other thing I'll add to this is, especially in when you're building a health tech company, it's a little bit different in the sense. What we're trying to do is bring in two types of people, broadly speaking. One is the deep domain expert in healthcare, and the second is the deep technology expert, and make them work together, right? And we're doing this at every layer of the organization. Like I was very insistent, for example, when we composed the board, that there had to be an healthcare expert and a tech expert sitting on the board. Likewise in the leadership team, likewise at the ground level. Now, on the surface, academically speaking, this seems easy to do. But if you peel back the onion, right, these are two very different cultures. Healthcare is very cautious, it's conservative, it's a bit old school, it's regulatory, it's compliance related. And when you talk to deep domain experts in healthcare, they are cautious. They talk about regulation. They worry a little bit more. They don't take as much risk. They like to innovate in a bounded way, right? Then you talk to the high tech people, they're very creative. They want to move fast. They want to build something. They want to have an impact tomorrow. Speed is everything, right? So, when you mix these two, you have to get the right medium between those two. And you have to also make sure that the two work well together. And I think if you can crack that code, then you can build a very unique company. And that's what we have set out to do at Daffodil.
Yeah, that's interesting. I feel like there's obviously as you mentioned, like a natural friction there between the curmudgeons of the healthcare industry. And I don't mean to frame everybody that way, especially if they're trying to work at somewhere like Daffodil, they are more forward thinking for sure. But I've heard from other folks who say, yeah, we hired these deep domain experts, but there were some cultural issues, like you mentioned. So I'm
Mhm.
curious, like, are there kind of when you kind of were starting to build out Daffodil and beginning this process, are there specific examples of certain things where the two sides did butt heads, and how did you guys kind of navigate through that, if that makes sense?
Yeah, no, I mean, I think, yes. I mean, like, for example, right, when you're starting very early and you have five people and a dog on the team, right? In the sense you've got C Cap, it's a very small team. And you have specific milestones you need to hit in terms of ensuring that you can prove the market thesis you started with, you can prove ROI, and you can be in a good position to raise the next round of funding to further build a business. So there is some pressure there, right? A person with a high tech background likes to start moving and getting things done yesterday. Now, the person with the healthcare background is worried about HIPAA compliance, is the
Hmm.
data secure, and a bunch of different things, right? The key is one, to find that middle ground in terms of what is practical and what needs to be done. So that's one. Second, I think, which is extremely critical, to ensure that both sides understand what the true north star is in terms of the business we're building. We are building a business to reduce admin waste, to make a difference, right? If that alignment is there, a lot of other things can get resolved through conversation. And third, I would say, encourage open discussion and debate, but also have alignment with the team that once the discussion and debate is done and a decision is made, whether you agree with the decision or not, you're all in. Whether you like it or not, you're all in. Because we have had a chance to debate. You will not agree with everything, but you need to commit to everything as part of the team. Right. So that's how we've generally handled it.
Yeah, but that's great because everybody has a voice and feels like they're part of that journey. So I imagine that helps with open dialogue and also transparency within the company. So That's
Yeah, and
that's
this
awesome.
incidentally was, like two of my co-founders. One is a CTO. He's got a PhD in computer engineering, very deep technology expert. Then I got Adrian. His name is Shoyang, and I've got Adrian, who's got 20 years in healthcare. And it's two very different cultures. And I think it takes some time for things to settle. But the more conversation there is, the more alignment there is. Once a settlement happens, what you produce is pretty phenomenal.
Yeah, that's fantastic, and hope you guys continue to produce phenomenal things. But I think that that's a great segue. Maybe you could walk me through, Daffodil's founding story and the thesis at play and the pain points you guys are trying to solve. You kind of alluded high level to reducing administrative waste, but I'd love to hear it from the horse's mouth as far as the specific problems and what you guys are building.
So let me share with you. 2023, I actually wrote, I think it was a 25-page paper on what I thought was wrong in healthcare and what needed to be fixed. So that was the genesis. But I'll tell you the summary thesis, right? The two endpoints of healthcare are the patient receiving the clinical service or the drug or whatever, right? And then it's the clinician providing the service, right? So
Mhm.
those are the two endpoints in general. Everybody else is a middleman. The employer is a middleman, everybody else, but the payer is a middleman, everybody else is a middleman, right? The hospital administration, I would call a middleman, right? Now, the question is, if you're a middleman in this system, my belief is that you should add value to earn your keep. If you're not adding value, you need to be taken out. So we basically said, okay, who are all these middlemen? What value are they adding? Which of these middlemen can we use technology to disintermediate to reduce the cost of getting that job done so we can reduce admin waste? So that became the higher level thesis. So when we looked at it from that approach, we identified a couple of processes that we thought were very, very inefficient and ineffective, right? One was the out of network repricing process, and another was prepay payment integrity. So we identified those two processes. So we looked at what was happening in the industry in terms of when a claim is not in the network, how does it get settled between the payer and the provider? Who all get involved and who all make money off it? And we decided that this process today using technology can be automated end to end without any slack in pricing performance. So that was the thesis we built for the first solution. And today we have proven that in terms of we've actually implemented in multiple customer locations. And we have shown that you can do full automation, and we have shown that it can be done at a fraction of the cost of what payers are traditionally paying for this particular service. So that's a little bit. So I can tell you a little bit more about an North Star, but that I think that kind of answers your question at least.
Yeah, it's very helpful. I'm curious. So, because you spent time at Multiplan, which is now Claritev, right?
Yeah.
Which when did they make that change? I don't even remember. I feel like healthcare incumbents are always changing their names. But you worked on product there, correct?
Hmm.
And so Daffodil is more or less kind of like, and you can correct me if I'm wrong, but like an AI native,
Hmm.
tech forward, better, better version of that previous model, more or
Hmm.
less. That's the thesis, right?
That's correct.
So, what was kind of the turning point in your career and working within the beast and then saying, hey, I'd rather create something new, start from scratch, like outside of the beast? Like, what kind of spurred that decision making, if that makes sense?
So I'll give the higher level answer. I don't think I can go into specifics. So, but when I was at Multiplan, my goal was to automate things inside Multiplan, was to change the product direction and strategy because I knew what was coming. I could see it around the corner. I saw the increasing focus on regulation. I saw the government pushing for transparency. I saw the need for payers not only become transparent, also become auditable. So, and I thought we've got to change the model. We got to change the product. We got to build a more automated product. I've written quite some documents inside that organization to try to get alignment. I even went in front of the board 3 different times. I like building businesses, but more importantly, I like making a difference. And if I can't make a difference, and if I need to be a corporate executive, just crossing the T's and dotting the I's, it's not me. And I had an open conversation with the CEO, and he understood. And I think I stayed on for the transition for about 4 or 5 months, and then left to start Daffodil.
Yeah, it makes a lot of sense. And I mean, credit to you for, you've talked a lot about how at Daffodil and internally and in your previous roles, you want transparency and employees to have a voice. And you felt like your voice wasn't necessarily, it sounds like your voice wasn't necessarily being heard. And maybe you ran into kind of, traditional status quo healthcare incumbency. We don't need to do anything differently because our model's working and there's risk and change.
Yeah, so I think so Blake, that is part of it. I think part of it also is when you're a public company at that size, under the constant scrutiny of the public markets, the risk you take by trying to change is so high, and sometimes the board
Mm,
and the CEO doesn't want to do it, doesn't want to take that kind of risk, and that is understandable. I don't blame them, or I don't say they're not doing enough. I just think in that structure, I could not do what I wanted to do.
Do you think economically speaking, let's say Multiplan now tries to do some version of what you're doing, or like really implement AI automation or whatever, does that economically hurt them? Like, as in, like, would that result in revenue declines or like margin profile changes or those sorts of things? I guess.
So I'll answer this in two ways. One is in general, when a company with a legacy economic model, a legacy technology architecture, legacy product assumptions, and a culture that has kind of ossified over multiple decades in terms of operating in a particular way, when they try to make a change, one, it's brutally difficult. Two, it is extremely expensive. And third, which I think is probably the most important, like even if you were to say you could do one and two, you could force it through, trying to do it under the glare of the public market is very hard. Like if you look at the history of organizations, I think the only company that I've seen that has successfully transitioned this in terms of moving from one model to the other, obviously the obvious example is Apple when Jobs came back. I would say in B2B, the other example is Adobe when they moved
Mm,
from the desktop model to the SaaS model. I thought they pulled it off under the glare of the public market. They did a pretty brilliant job, but it's very rare. It's not easy to do.
sure, sure. Yeah. And I don't know, maybe it's just a, secular trend thing as well, especially with new technology coming through, because you've seen, everybody has probably seen in the news. Well, maybe people who are around healthcare, maybe the nerds have seen this, but they've had a lot of scrutiny of their model and the
Yeah.
antitrust and other things happening. And it doesn't seem like their business model is necessarily doing great in general. But maybe we can shift away from kind of the negatives of that and move more toward, the future economic model of this business and Daffodil. You mentioned kind of you have a great couple of co-founders and a great team around you, the tech forward people with the clinical expertise and healthcare expertise. What does it mean to be AI powered as a healthcare startup in 2026? Can you walk me through what that actually means?
Yeah, I think so. AI powered in 2026, right? So how is this different from, say, technology enablement before? I think one of the common complaints about healthcare has been over the last couple of decades, while the technology was supposed to solve problems, but they almost always seem to either create more problems or become more expensive, make healthcare more
Mm,
expensive, right? So they never solve the problem of waste, so to speak, right? That's been the frequent thing on healthcare. Like even if you look at EMR records and how when that was mandated, a lot of the rollout was botched, a lot of errors were made. Physicians got burnt out because instead of looking at the patient, they had to look at the computer and keep entering notes, right? So there's a lot of issues with technology in general as applied to healthcare when compared to other sectors. I think what's different in my mind now is, especially with generative AI, you don't just need, digitize a complex process and the complexity essentially doesn't go away, it just stays. What you can do today is you can automate that entire process because healthcare is very human intensive. When you talk about a workflow or a process, there is human involvement in different elements of it. With generative AI, you can essentially automate parts of that human element as well, and you can complete a task or a job much more end to end than you could before. So I think this is kind of a new opportunity for the sector and for companies to build interesting products that automate some of these admin processes and take away the waste.
yeah, and that's fantastic, and I think it's super exciting because we're kind of in the gold rush era of that right now, right? Lots of executives and a lot of excitement. Curious for your perspective. This was somewhat recent, and I'll give my take, and I'll would love to hear yours. I think it was maybe in Stat News or some think tank institution that came out and said, no, actually, AI right now is increasing costs in the healthcare system. And
Mm.
from my perspective, I look at a model like Daffodils or another company that's trying to, install agents into the system or automation or whatever it is. And maybe it varies by healthcare space or economic model. But in my opinion, I think we're in kind of that yes and slash investment phase, infrastructure phase of healthcare where we're not necessarily seeing results of change, or we are, but on a limited degree, but there's still kind of incumbent players, incumbent solutions in the mix as folks are, experimenting and adopting and those sorts of things. And plus there's job displacement fears and everything else politically that goes into that. So I'm of the opinion that we're still in that like kind of transition period. We can't necessarily like make a claim like no AI will only raise costs necessarily, but I'm curious for kind of how you think about that dynamic.
Yeah, no, it's a very interesting question. I think broadly I agree with you. Just to add a little bit more layers to it, I think one way to think about it is, like I've heard this argument that, for example, the providers are going to invest in AI with prior auth requests or upcoding or whatever else, RCM and so on. Peers are going to do the same. So all we have created is two sides of the table, both investing in more technology, and therefore all it is going to do is increase costs, right? So that's one view of the world, and that view of the world is valid only when you view AI and healthcare in a narrow sense. But if you look at it much more broadly and deeply, right? Like, for example, if you said an admin process that was being done by a company or a person, if that can be automated at 10% of the cost, that is truly taking healthcare costs out, right? So there are those instances, right? Likewise, for example, we have a huge labor shortage, both amongst physicians and amongst registered nurse practitioners. If we try to solve the problem only through training or trying to find people, it's going to be extremely expensive at the end of the day for the patient. But if you can supplement what they do, what human beings do, what professionals do along with AI, you could do it at a much lesser cost. So I think overall, AI is much more of a general purpose fundamental technology that will make things better. So I'm much more in the positive camp because I don't think you should look at only one silo and decide that this is going to be negative. You look at the whole picture, I think it's a huge net positive overall.
Yeah, that's a great perspective. And I think maybe the framing of that initial argument was, hey, they're only investing in kind of RCM functions and AI scribes, and that's, upcoding kind of potential abuse and those sorts of things. But to your point, there's also the payer reckoning probably coming. If it's not now, it's soon, where they're like, we know you're doing those things and we're going to invest in our own solutions and so forth. And so the dance continues. I like to call that the dance with dragons, from
Yeah,
a
I mean,
writing perspective.
so, Blake, just a quick comment on that, right? So I agree with you on that. There is one example though in healthcare that has actually played out, like No Surprises Act, for example, right?
Mhm.
Now that was passed with the intent that patients don't get billed unnecessarily, or they don't get surprise bills. You don't go to get a surgery, nobody tells you the anesthesiologist is out of network and you get a huge bill, right? That's not fair to the patient. So in terms of having the intended effect of patients not seeing surprise bills, it has been effective. It is a net positive. The downside is it has created an arbitration layer where both providers and payers are investing in fighting disputes and going to arbitration. Now, I feel like, okay, so the expense went up, but the effect was positive. Now with AI, I think the expense can come back down again when you automate that entire NSA process end to end. So I think, yeah, I mean, there are multiple layers to this, and it gets played out, I think, in sequences.
Yeah, that's a great thought, kind of the stepwise incrementalism of everything. And I'm glad you brought up the No Surprises Act because that was going to be one of my questions for you. Is it seems like for the most part, providers and payers, they can't come to an agreement or there's an out of network situation dispute, and for the most part there's a process for those folks, but then there's the maybe the top 2 or 3% of folks who are just flooding the system with
Mhm.
abuse and kind of trying to game it and take advantage of it. So you talk about automating it. What in your opinion is working well in that whole system, and what do you think, where do you think are there areas for improvement, and how does Daffodil play within that?
The act and how it is working well or not, right? So I think the act is working well in terms of ensuring that patients don't get balance billed or surprise billed, right? In that sense, I think it is working. I think it was a required act. Where it's not working well, I think, is in the money being spent on arbitration by both sides. I think that can get reduced with technology. The other aspect where I think it's not working well is if you look at the results of the No Surprises Act, they're very heavily skewed in favor of the provider. And you're right, it is this is likely two, three, or five players resulting in this kind of skew, but it is skewed in favor of the provider, right? I think 88% of all disputes are resolved in favor of the provider. And in addition, I think if you look at the numbers, I think there's almost 20% where the payer is not even able to respond. Part of the reason for this is the providers have adopted AI much more quickly, much more aggressively than payers. Probably for the first time, in a couple of decades, the providers have have adopted AI on a front foot, right? So there are certain things that are being played that are you could call them ethical or unethical, but they're definitely legal, unfortunately. Which is providers have a tendency to say like, and I've seen this instance where they dump a bunch of NSA claims on an afternoon, and if the payers are not technologically enabled, they don't have the ability to respond to those notices in the time frame that is required. And in many instances, the arbitrator decides in favor of the provider because the payer did not respond. So those things are not working well because I think there is an imbalance right now between how well the providers operate with respect to NSA and how well the payers are operating with respect to NSA. Look, and this is no excuse for payers. I think it's the payers' responsibility. It's the responsibility towards employers, towards their members, embrace technology and to operate in a manner that they can compete in the marketplace. So I'm not making an excuse for the payers, but I'm just pointing out that there is an imbalance there because they've been slow to adopt technology and be effective in the NSA process.
Yeah, and that's interesting because if I'm a employer or a customer of that payer, then technically speaking, they're not necessarily being the best fiduciary they could be doing in that whole process. So I would assume that payers would continue to partner and or build or find that technology or manpower or whatever that is, or they're trying to change the law, right? The arbitration process today, and correct me if I'm wrong, is it the arbiter chooses one price or the other price, or are you able to kind of meet somewhere in the middle, or how does that part work?
No, you typically choose one price or the other. So the
Okay.
provider makes an ask and the payer makes the best offer, and the arbitrator typically picks one. The arbitrator is not mediating, so they're just making a discrete
Okay. Okay.
decision. Yeah.
Gotcha. And so on the provider side, I would assume they're just offering up what their gross charge is.
Yeah, so I think the provider, the whole billing system is interesting in this sector, right? So this is how healthcare works, very unfortunately. You go get a service in a hospital, and almost all the hospitals or physician offices, if you will, they send out a claim with what they call the billed amount. The billed amount is based off a charge master. The charge master is like a hotel rack rate. It's there, nobody pays it, but it's still there, right? So it's one of those things. Now, you would expect, like in most sectors, if I, as a provider, have a contract with a payer for a clinical visit to be $300 and it's in the contract, then I would send an invoice or a bill for $300. Healthcare doesn't work like that. Even whether I have a contract or I don't have a contract, my job is I look at the charge master says $1,000, and the charge master is arbitrary. It's created and maintained by the provider. So they put in $1,000 and just send it out. Now the onus is on the payer to find out if they have a contract, and if they have a contract to then say, no, your allowed amount is $300. So no other sector operates like this, right? So likewise, if it is out of network, you get a bill for $1,000, then the payer essentially comes back with, well, $1,000 is too much, so why don't we pay you 150% of Medicare, 140% of Medicare, right? That's how it gets settled. So if you step back and look at this whole ecosystem, right, in terms of how it operates, when the provider sends a bill for $1,000, they are not expecting to get paid $1,000. They know they will never get paid $1,000. The national average is it settles at 50% of bill charges. It settles at about $500. That's the national average. The payer knows that the provider is not expecting to get paid that much, right? So in spite of this, there's this artificial game and back and forth that is played, And there are people in the middle who sit there and claim, hey, you got a $10,000 bill. I saved you $6,000. Pay me 25% of 6,000, which is complete BS because it is an artificial fake anchor, if you will, right? So it
Yeah.
doesn't make any sense.
Kind of reminds me of like drug pricing too, right? And the
Right.
game
Yeah.
on
No,
that side. It's
yes.
very
Yeah.
similar. I'm curious from your opinion, because you guys kind of sit in the middle of that too, right? You're trying to resolve out of network disputes. Have you guys built anything proprietary? Because I feel like from the provider side, there's some opacity around like what are the inputs to cost and then therefore to price, right? Like
Mhm.
for various services. Have you built anything around that to like try and identify like true price, or is it more kind of just like market based or regional based, like those sorts of things? How do you kind of think about that dynamic?
What we do is obviously CMS does a lot of work in terms of figuring out what the Medicare price is, and they do it based on first principles. So obviously we use that one as an anchor, and we basically allow the payer to say, do you want to pay 20%, 50%, 70% above what the government pays? So they can set that up inside the system. So that is one way. A second way is basically market-based pricing. So based on the MSA. So if you want to pay the 40th, 50th, 70th, 80th percentile on the MSA for that code or on the state or the country, you can set up those parameters as well. So you essentially allow the payer to set how they set up the system in terms of how they want to pay. Now, what we don't do is use AI for suggesting what a claim should be priced at, like you, especially generative AI. The reason we don't do that is we don't think that a black box should be used for pricing, especially in
Mm.
healthcare. Any pricing decision, editing decision you make has to be logic based, it has to be explainable, it has to be auditable. So, our use of generative AI is more in the communication with the provider, it is in the creating of a benchmarking report, it is in creating an arbitration package for the arbitrator in case of IDR, NSA claims, but not in the core pricing itself or the core editing itself.
Okay, gotcha. That makes a lot of sense. And so I should have clarified at the beginning, but do you mostly work with the provider side of the equation or payer side, or are you kind of both?
No, we work primarily in the payer side of the equation. We work with TPAs, regional plans, national plans. We work with the payer side.
Gotcha. And then are you able to surface insights? Because as I understand it, and correct me if I'm wrong, but the old model of doing this, or maybe, still, I guess, current, is hey, we're going to resolve this out of network bill and you'll give us a slice of the savings. So it's kind of contingency pricing. And then from what I understand, and is your company is more so because it's automated and you're able to do things maybe a little more nimbly. You say, hey, just charge us, you have X number of out of network claims, charge us just this fee, flat fee,
Hmm. Hmm.
and then kind of go from there. Is that kind of
That is
the
correct.
current setup? Okay.
That's correct.
I feel like there
Yeah.
are a lot of actually, from a wedge perspective, a lot of digital health companies who quote unquote put their fee at risk as like the model, right? But you're kind of doing the reverse here. So how do you navigate that economically?
Yeah. So I think fees at risk does make sense. Outcome based does make sense if it is truly at risk and if it is truly outcome based, right? So, and I'll explain what I mean by that. So, in a subdomain where everybody knows that $1,000 bill is going to settle for $500, to claim that you took risk, to claim that you saved money, and then charge a percentage of that is disingenuous. It's wrong.
Mm, I see.
So here's what we do with our payers. We tell them, so you're worried about performance. So let's do this. You give us historical 90 days of claims. Let's compare our pricing performance with the vendor you're paying an arm and a leg to. If we do as well or better and do it for 10 or 15% of what you're paying the other vendor, you keep more money. We're not going to ask you for, we're not going to say, oh, pay as a percentage. Ours is a technology model, software licensing model. We will tell you what we will deliver and we will deliver it. And you pay us a pre agreed fee, keep the margin, right? And that is pretty appealing to a lot of payers. So that's how we are approaching it. That's why we are using the flat fee model instead of the percentage savings model.
Yeah, that makes sense. And so they make leverage off of you rather than growing with, or like Yeah, I can see how that feels better for potential customers for sure. I'm curious. I'd love to ask you just like a philosophical question because, in theory, and you feel free to push back on this, but
Okay.
we don't necessarily want out of network to exist at all, right? Like
Hmm.
in the grand scheme of things, I know there's competitive forces, negotiation, and all these things. So, let's say there's some sort of expansion of the No Surprises Act, or I don't know, out of network is solved. What happens to Daffodil from that perspective? Like, are you guys just using out of network as a wedge right now and you're looking to expand into something more full service? Or I guess what does the future hold for you guys in that scenario?
Yeah, no, it's a great question. So, yes, outer network is a wedge, and I'll tell you a little bit about how we're approaching it from a product North Star perspective in terms of making a difference to healthcare. But before that, I just want to mention that I think theoretically, I think it'd be great if there was no auto network. And if everywhere we went, it was a network and there was a pre agreed price. Now, if you go all the way to saying, for example, like in Japan, the government publishes a price sheet and you're just supposed to follow the price sheet, then we're beginning to move towards less of a free market model, more of a government control model, which has its own risks, which has its own downsides to it. So I think my take is, philosophically speaking, if we want to be a free market or as much of a free market with regulation as possible, outer network will exist. And the reason I say that is a patient or a member, they may want in a particular critical situation to see a specialist who is not in network because that's who they trust and it is very critical for them. It's also possible they go, they're traveling, and the plan they have doesn't have providers in that region either because it's a narrow network or because it's a smaller network, in which case they are forced to go out of network. So there will, practically speaking, I think there will always be instances of out of network claims. But I'm a big proponent of, do we need to reduce out of network claims as much as possible? Yes, I think so. I think the lesser they are, the better. I don't want to build a business for the sake of building a business. I want to build a business that makes a difference. So to answer your question on how we're thinking about our North Star, right? So our goal is to destroy admin costs in healthcare. So that's where we are starting. So we identified out of network. We're doing prepay payment integrity. Now, destroying admin costs in and of itself, I don't think is going to do a big enough dent in terms of healthcare costs for our country. I think the other thing we're looking at is today when employers go for a plan to a payer, sometimes an employer says, "Hey, I just have two locations, 300 employees in one and 200 employees in another." But they're forced to pick a plan that is broader than that. They're forced to pick a network that is broader than that. Now, if you make it possible for payers to custom design a plan based on the employer specific needs, based on age of the employees, the general health, blue collar, white collar, the places where they're located, do they travel or not? And if you can do custom plan design, then the employer is not paying for more than what they need, and the cost goes down that way as well. So we are looking at ourselves as becoming a smart plan platform. So that's part of so doing some of this pricing editing is almost like a phased journey towards getting to that smart payer platform. Now, the last thing I'll say is changing individual behavior that can also impact healthcare costs. So if you look at the sector as a whole, for example, I want to get an MRI. There are locations that will charge $300. There are locations that will charge $2,000. So if you can set up in that smart plan platform, in that plan design, a way to incent employees to go to the right place, to the high quality, low cost place, maybe you give them a rebate for $200. Maybe you write them a check. But if you start incentivizing them to make the right decisions where money is at play, then you begin to influence patient behavior, member behavior. So I think there are multiple things to do here. So our goal is to be that smart plan platform that catalyzes payers to do plan design, to take actions that result in lower healthcare costs.
That makes a ton of sense. And it sounds like a natural extension of what you guys are already building, to your point, because you
Mhm.
already have kind of pricing information and you're building out that kind of chassis as well. So,
Yeah.
yeah, that's fascinating. Very cool. I think my last question for you is from a healthcare perspective. You've raised around $20 million to date ish, maybe a little more than that. At least that's what's public.
Mhm.
From your perspective, what was the environment like, when you were raising your seed versus now? And, what advice or learnings do you have for, listeners or other founders or investors kind of in this environment?
So looking back, right? So when we raised the seed round, I think our experience pretty much mirrored the state of the market at the time. The market was difficult to raise capital during the time. So the investors were skeptical, and the investors who were interested did drive a hard bargain. So in that sense, the fundraising process was a bit more difficult. It took a little bit more time. Having said that, to be fair to the investors, we were raising money at the time based on a thesis and based on a PowerPoint deck, so which also made it harder. What helped us was, I think, me not being a first-time entrepreneur helped. Having a deep technologist, Shaw Yang, as a co-founder helped, and having deep domain expertise with Adrian also helped, right? So it kind of gave us credibility, and it made the investors want to lean in. And also, we had corroborated the problem with a couple of customers who were willing to go on the phone with the investor and outline the problem in a lot of detail to them and say that if a solution was built that solved the problem, they would buy it, right? So those things all helped in terms of us closing that round. In terms of the Series A raise, the market was at least. A lot of people said the market was still tough, but we found the market a lot better, and probably because we had implemented our software in customers, we had delivered an ROI. Customers were willing to go on the phone and say that they had saved seven-figure dollar amounts by using our software, and we were expanding rapidly. So because of that, the Series A raise was a lot quicker. In fact, I think when after we started the raise, within about 3 weeks, we had a verbal term sheet, or 3.5 weeks, we had a written term sheet. So it was very quick. So in that sense, it was a lot easier. So in terms of what I would tell entrepreneurs in general, or people raising capital, is to worry less about the market, to worry much more about building the business, to worry much more about solving a problem that is acute, that is necessary, that is deep, that is causing pain, and having a solution that is differentiated and having deep expertise in it and focusing on it. I think if you can do that, and if you can tell that story, you will raise money irrespective of which market it is. Maybe you give up a little bit more, a little bit less, depending on what the market is doing at the time, but you will build your business. And in the long run, things will even out. So you don't need to worry too much about it.
Okay, that's great advice, especially from somebody who's, been in the game for quite a while. So thank you for sharing all that. And my last question is something somewhat tangentially related to that. I want to know, and this is what I ask all of my podcast guests: what's a piece of content, book, media, something you've consumed has fundamentally changed the way you live your life?
So I'll answer the question a different way first, but if you still want me to pick the piece of content, I'm happy to as well. Like as most of us, I do a lot of reading, so I'm happy to give you a piece of content that has influenced me heavily as well. But before I do that, though, I'll tell you the thing that at least that has had a huge impact on me in the last 10 or 15 years. After I sold my business, DNN, to the private equity firm, I took part in a meditation retreat called Vipassana. So it was a retreat for about 10 days. For 10 days, you don't talk to anybody. You eat once at, I think, at 6:30 a.m., another time at 11 a.m. So those are your two meals for the day. You spend the entire 10 days meditating. You get about 6 hours of sleep, of course, a day. You don't need much sleep when you're quiet and not doing anything else. No reading allowed, no writing allowed, no talking allowed, obviously no screen time, right? So I think to me that was an incredible experience because it helped me take a step back. It helped me get centered a little bit more. And I began to do that practice every day since then. For me, it helps me be a little bit more equanimous, a little bit more centered. The highs are not as high, the lows are not as low. It helps with better decision making. So I think that's the one that has probably influenced, that has changed me, that has probably made me better, not just as a leader, but even at home, as a family person, as a husband, as a father. I think that's made me better. So I would say that's the one that has moved. It's not so much content consumption as the lack of content consumption for 10 days that's made me better.
No, I love that. I'm actually going to rephrase my question to, include experience or person or other things too, because that's very profound, and I appreciate that. Kind of reminds me of, I had this one pretty great college professor, and he would always say, "Nothing is ever as good or as bad as you think it is in the moment." And
Yes.
for me, I try to remember that, but also to your point around staying present and kind of
Mhm.
transcending current situations to trying to understand who you are and what your values are and those sorts of things. So I appreciate that reminder. And that's maybe I need to do a 10-day meditation retreat. It sounds like a pretty transcendent experience.
No, absolutely. Let me know if you want the details. I'm happy to share them with you and would love to hear what you think of it when you do it as well.
All right. Next Hospitalogy event. There we
Yeah.
go.
Awesome.
Yeah. All right. Naveen, thank you so much for the conversation today. I learned a lot. I will definitely, continue to follow you and in Daffodil Health's journey. Best of luck to you in the rest of 2026. And
Thank you.
thanks for your time.
No, thank you very much. I enjoyed this a lot. Thank you. I appreciate it.
Likewise.